I don't remember anything for a few weeks later when I woke up. They came home from school like any other day. Julian, he'd get off the bus and he would be the first one to find me, to tell me, Mom, we're home. And that day I didn't respond. For him to find me that way, he covered me, he put rags under my head, and he went and got his brothers and he said, something's wrong with Mom. The boys had called 911.
They said, oh, the chopper will be here in 5 minutes, sign here. I said, whoa, chopper? What are you talking about?
From the local hospital, Cooper sent their helicopter to get me.
They called me en route and said, we need to do emergency surgery. And I said, do what you have to do. And they did.
Judy came in with what we call a ruptured intracranial aneurysm. In fact, she had 2 aneurysms. What she came in with was blood around the brain, and this increased pressure causes people to be almost in a coma. Speed is absolutely of the essence. There's no question it is life-threatening. In her case, having a drain in the brain, that was #1 priority. It doesn't get the patient out of the woods because it does not deal with the blood that's already there. What you need to do is place tiny coils that are made of platinum, as thin as a hair, in this aneurysm. So the technology allows you to release the coil when you're satisfied with its position.
In the ICU at Cooper, if a doctor says, I need this, it's done. And I mean, it's done. It moved so fast.
No other doctor would have touched my aneurysm. Dr. Joven took that chance and saved my life. Dr. Joven, he's awesome. He really is awesome.
The neuro department was like one big family. All the different therapy departments came in, occupational, speech. They cared what my concerns were. It wasn't just we have to treat the patient. You know, they have to treat the family member that's sitting here every day also.
There is no other place in southern New Jersey that has the same level of expertise and infrastructure to deal with these kind of problems on a 24/7 basis. I was lucky to be able to work with a highly trained team that is unparalleled in the region.
She was speaking in 10 days.
When we actually were talking to her and she could respond back to us. It was reassuring that she was okay.
32 days after I was brought in, I came home to my family. My 3 older boys are triplets. My youngest, Eli, he's our surprise baby. Life is very, very busy. There's a couple people that rely on us for eggs.
I've raised them since they were babies, and it was a mess.
That was my fingernail. Hey, that's my jacket.
Judy's case is just an example of the comprehensive care that exists at Cooper.
This whole stroke thing has been so life-changing for me. I have amazing boys, I really do. Yeah, we got 9 today.
It's arguably the most satisfying thing somebody can ask for in their profession.
6 brown and 3 white.
To see the patients, you're able to help them and get them back to a meaningful life.
Everything was about me and my care, making sure I was comfortable, making sure I was happy, and on the road to recovery to get me home to my children. So today I planned a special trip for my boys to go to the lake and have a picnic, just us, to celebrate that I'm here. Just to explain how great Dr. Joven is, I have to keep going back for angiograms to check the stents in the 2 aneurysms. Him and I were singing Queen together while he's in my brain.
I do typically ask the patients if they are okay with the music. We clicked right away. Turns out that Judy was a big Queen fan.